Hi, my name is Jessica Drummond. I'm the founder and CEO of the Integrative Pelvic Health Institute. In this video, I'm going to show you the skills that are essential for overcoming your fears of handling both complex clinical issues from a holistic perspective and getting to the root physical, emotional, and practical causes that are keeping you from partnering with your patients to achieve her ideal results. I'd like to start by talking with you about why specialization is so essential to your health, wellness, or coaching practice. Let's face it, there's a lot of noise out there. Your patients are getting information about their health from more sources than ever. Unfortunately, the loudest sources are not always the best sources. Your patients and clients need your help to navigate the massive amount of health information that they're exposed to, and they need you to have the skills that will help them to trust their own inner healing wisdom. To become a specialist with this depth of skill, you need training. Becoming a skilled holistic women's health specialist broadly means being an expert in two distinct areas. Number one, sharpening your inner science lever. You've got to know how to confidently understand, critique, and apply the latest published research on nutrition, nutrient supplements, herbs, stress resilience, sleep strategies, movement, exercise, and other wellness tools. And number two, you've got to sharpen your skills as a top women's health coach, because every client or patient that walks in your door is a complex, feminine human being with practical challenges, fears, and past experiences that are contributing to the total picture of her physical health. You've got to understand and become practiced in effective coaching skills like mindful listening, reflection, and understanding and recognizing change readiness communication. You've got to have the experience and tools to effectively provide your patients with communication skills to integrate challenging relationships and work and life transitions into her health conversation. Coaching women is different from coaching men because women and men have distinct brain structure and physiology. Women and men have different roles in society, and women and men have different hormonal and brain neurotransmitter biochemistry and cycles. Not to mention the basic differences. Women get pregnant, bear children, breastfeed, and transition through menopause. Women have distinct stress responses and communication patterns. Let me explain this with an example. If your patient comes to you seeking your help with her painful periods, you have to understand the published research on the holistic options available to her for reducing the pain. And you have to understand how to support her to make the changes that you recommend, such as eating more omega-3 fats or doing specific yoga poses during her cycle. You can't just tell her to do those things and expect her to do them, because quite frankly, and you know this, she won't. Making healthy behavior change is hard. You will also need to coach her through her challenges. Like, what do you say when she asks, where do I buy the best fish? How can I cook it if I never cook fish? And my family hates fish. What do you say when she tells you she doesn't have time to do yoga, even though she wants to and knows that it will help her? The bottom line is that if you want to help your patient or client get her best possible health result, to get the result that she's coming to see you for, you have to be a confident expert in the unique holistic wellness foundation of women. You have to be both an expert in wellness science, the science behind optimal nutrition, food as medicine, and other essentials of wellness, so that your other treatments like therapy, surgery, or medication will be effective for the long term. And you won't be spinning your wheels with patients who seem to get better and then just get worse again over and over and over. And you have to be an expert women's health coach. You need to have the skills to help your patients navigate the complexities of being a woman in the modern world. This is simply not taught in professional healthcare programs, and coaching programs leave you with basic coaching skills, but don't integrate the unique neurophysiology and modern practical demands of being a woman. You've got to be a specialist. Being a specialist is good for business too. You'll have increased confidence in your ability to treat and get results for complex women's health patients. And if you're trying to grow your practice in a competitive environment, having the advantage of being a certified women's health specialist from a respected program will differentiate your expertise in your community. Specialization makes it easier to effectively and clearly define the focus of your practice, to get better patient results, and to attract in the new clients that you want to be serving. When it's clear to your community who you care for and the specific results that you help your patients achieve, it will be far easier to serve those women that are currently slipping through the cracks of our modern healthcare system. When you become specialized as a holistic women's health and nutrition coach, you'll have the skills that you need to get results for even your most complex patients with ease. And it will be clear to your ideal patients where to find you. Next, you need to learn the risks and pitfalls of trying to learn the holistic nutrition and advanced coaching skills you need to become a women's health specialist on your own, and how to avoid falling into those traps. Like spending more time and money than necessary traveling to conferences all over the globe to learn the information piecemeal, or being swayed by sales information from supplement companies that don't look at the full picture of the research, just what makes them look good. In the next video, I'll show you exactly what those training risks are and how to avoid them, and how to assess the options to select the specialist training that will work for you. See you there.